Good morning, Illini, and welcome back. It is another Healthy Illini podcast, and I'm your host, Matt Schrock. And we are full swing into the semester. It is the fall semester, and anytime you're on a college campus in the fall, the conversation turns to cold and flu and things like that. So that's our discussion today, and we're going to give some tips and things to watch out for if you are dealing with any of those types of issues. Today, I'm joined by two of our staff here at McKinley Health Center, two of our nurse practitioners, and we have Kara Myers, who is a first-time guest here. Kara, thanks for being here.
Thank you.
And then we have a veteran of the show at this point in our not that long, but we have a decent amount of episodes here. And Todd, I think this is your third or fourth. We weren't really sure.
Third or fourth. I'm working on getting this changed to Toddcast instead of podcast. So.
Todd Johnson, another one of our nurse practitioners, is back with us. Todd, I appreciate you coming back.
Glad to be here.
When we talk about college and talk about the university experience, we're constantly talking about how students are active. They're very busy, whether it be academically, socially, even athletically. They just have a lot on their plate, and they're balancing and juggling a lot of things. And the danger with that a lot of times is that you can wear your body down. Often, we've talked about it a lot, that rest and taking care of your own health tends to fall down the totem pole a little bit to the bottom of the list. And so you're not as aware of those things. And that can take a toll on your immune system. And with that, we all know that it's coming into cold and flu season. And when you're already busy, you're already active, you're not sleeping well, you're not taking care of your immune system, and then you have these other things, it's very common on college campuses to deal with those. And there's a whole lot of infections we could talk about as far as respiratory and things like that. But the two that I really wanted to address today, and why I've invited you here, is we are going to talk about mono and flu, two of the big ones. But let's start with mono. First off, let's just talk about what is mono, because I think we've all heard the term, but we may not really be familiar with what it means to have mono.
Okay. So mono is actually a viral illness. It's not bacterial, which most people think that it is, and they want an antibiotic, which we won't do because it won't treat it. It's spread through what people say kissing, but that's not the only way. More commonly, what I see is it's actually spread through sharing drinks or sharing utensils, food. You're at a party, you drink after somebody else. You could get it that way. You may not know exactly where you got it because once you're exposed, it can take 1 to 2 months before you actually have symptoms. So it's something that could have happened maybe even before you got on campus, potentially over the summer. And now you're starting to be sick, in September, October. And that's usually.
So you say that we know oftentimes it's called the kissing disease, yes. But you said that it can be shared through drinks. Is it through touch or is it through
saliva? Yeah,
okay.
Through saliva. So if somebody drinks and then you drink after them, or let's say somebody was talking and they
spray a little.
Yeah, spit on the countertop and you touched it with your hands and then you touched your face.
And that's something that we learned through COVID, how much, for me, I didn't realize how much I did touch my face.
Yes.
Until I had a mask on, and I was like, I could itch or whatever, whatever. And it's very simple to have that kind of contact and not even realize it.
Yeah, because they'll come in and say, well, I haven't kissed anybody. And there's other ways,
right?
To get it.
On a college campus, people live in close proximity. You're in classrooms with people all the time. You're talking about sharing drinks and stuff. That happens all the time at parties and things like that. So it's not surprising that the possibility of getting mono is very much easily on campus. It's right there.
So what are some of the symptoms you look for with mono? As a student, if you're on campus, you're looking out for what symptoms to be like, oh, this might be something I needed to get checked out.
Sore throat is probably one of the number one things that people, really bad sore throat.
Big tonsils.
Yeah,
back there.
Huge tonsils. You'll see a lot of white grossness on your tonsils, which often people say is strep. But honestly, more often I see strep as just very red tonsils, and mono is the very large, white, gross tonsils. And then they're really tired. Their body aches, sometimes fever, headache, but most often it's sore throat, and I'm just really tired. And my neck, they get swelling of the lymph nodes in the neck.
One of the things that's usually missing with mono is nasal stuff.
Yeah.
You usually don't have a stuffy, mucousy nose with mono.
So what do you do if you think you might have it? Can you test for it? Is that something that can be checked?
Yes. So if you think you have mono, definitely come and see us. Here at McKinley, it is a blood test. So you will have to have your blood drawn, which I know most people aren't a fan of, but It's
But
quick.
You can't do it here. We have it in-house, so you can't
Yes,
do that.
it's quick, it's easy, and we'll take care of you. And I often check, in addition to the mono, we just make sure your blood counts are okay, and we check the liver function because sometimes mono can affect the liver. And all that's done with one stick. You don't have to be stuck multiple times.
Okay, so I'm going to come back to some follow-up on what you do if you have mono and things like that. But before we do that, I want to kind of shift gears and go to flu because there's a lot of similarities between these two diseases. And so would you share a little bit about what the flu is as compared to mono and why there are similarities, but also what differences there are?
Well, the flu is also a viral respiratory illness passed on through droplets, just like mono. So saliva, spray from sneezing or coughing, fomites. If people, sneeze or cough on a table, you touch the table, touch your face, it gets into your system that way. Fever, body aches, chills, sore throat and cough. Some nasal stuffiness and congestion happens with the flu. That's one of the things that differentiates it from mono. Usually not a lot of nausea and vomiting with the respiratory flu. And the flu is caused by the influenza virus, and there's hundreds of them out there. So it's a little bit different than, the adenovirus or rhinovirus or coronavirus or COVID or the other respiratory viruses that are out there. But comes around every year, and it gets passed on the same way as mono or any of the other respiratory thing.
Now you said no nausea. What if I have the stomach flu?
Well, stomach flu is a whole different ball game. Okay, we call this a viral gastroenteritis, right? It sounds better, but you know the stomach flu, right? You can get that from a bad burrito somewhere or something like that, or a food truck, or maybe your leftover pizza that sat out for 3 days and you decided, what the heck, there's nothing else to eat, I'll go ahead and try that. Those types of, they can be viral, it can be, a bacterial intestinal thing, food poisoning, and they usually pass within a few days, no pun intended, but viral things like that, if you just push fluids, they will work their way out of the system. Your body is literally trying to push it out. That's why you're having diarrhea and stomach pains. Your body's trying to clear it. But the respiratory type viruses are very different things.
And that's I appreciate you saying that, because that's what we're doing here, is trying to educate. Because a lot of times, especially students, this is your first time taking care of your own health, first time trying to figure all this out. And I thought the stomach flu was the same thing as the flu for a long time, even up to my adulthood. And so that's good information to have. The other thing that you mentioned that kind of brings me to the next part I want to talk about is you both said that it's not bacterial, so you don't take antibiotics. And so I want to get to the treatments, and what you do if you do have mono or flu. But would you talk a little bit about what that means? Because it's not a bacterial, why antibiotics you don't want to touch them?
Okay, so mono is viral. Antibiotics were developed to treat bacterial infections such as strep. That's a big one most people know about. So viruses, unfortunately, there's no way to get rid of them any faster than they're going to go away on their own. So we just try and treat the symptoms, and to treat the symptoms to make you comfortable. We may not be able to completely get rid of your sore throat, but let's get it to a point where you can eat and drink, which is really important. I'm more concerned about people staying hydrated. If you miss a few meals, you'll be okay. But if you're not drinking, there's more risk with that. So as long as you're drinking, that's really good. I usually, for mono, recommend ibuprofen. And if you come to the visit, we can talk about dosing for that. Although if you have a bottle of ibuprofen, it will tell you how much you can take on the back of it. Try to avoid Tylenol with mono because it can affect the liver, and Tylenol is cleared through the liver. However, if we have to take it, we can. I mean, it's not like you can never take Tylenol if you have mono. It's just a case-by-case basis.
And you actually mentioned in your prep work that taking an antibiotic with mono can have a negative effect.
Correct.
Because there's some schools of thought out there, not in the medical field, but in my parents' kind of idea, that just throw everything at it. If you're sick, just take whatever you can take and see what happens. But I didn't realize that taking an antibiotic with mono could be a negative.
Yep. So there are times where if somebody does maybe a televisit, right, where you can't actually be swabbed or seen in person, that they'll get amoxicillin, and it's the penicillin class of medications that's often given for sore throat. They think it's strep, and then it can actually cause you to break out in a full body rash if you have mono and not strep, which is why it's really important to be seen in person because we can actually swab your throat to check for strep, and we can do a blood test to check for mono.
So not only do you end up with a rash, the amoxicillin is not going to cure mono. And
Right.
now you've got everybody thinking you're allergic to amoxicillin and penicillin, which you're not.
Which you're not.
Yeah.
You're getting a rash, and an allergic rash to an antibiotic usually starts right away. Whereas we see these rashes with mono and amoxicillin that are 7 to 10 days, almost at the end of therapy or right afterwards. So it's not an allergic reaction. And now you're branded as being allergic to penicillin products for the rest of your life. So we have to be careful in using those things.
So what about flu? The treatments are very similar.
No antibiotics again. It's a viral thing. It's a whole different little single cell organism down there. We do have antivirals that we can give for the flu, but we reserve those for pretty specific cases. People with like pretty severe comorbidities like heart disease, diabetes, really bad, pulmonary issues, asthma, stuff like that. And they have to be used within the first 48 hours for them to even be effective. And they don't kill the virus. They reduce the length of time you're sick. They may reduce the symptoms. I mean, everybody through COVID probably heard about Paxlovid. Oh, you have COVID, Paxlovid. That's an antiviral, but it doesn't cure COVID. It basically makes you feel better sooner. And so the antivirals that we use for flu kind of do the same thing, but they have to be used right away in order for them to have any efficacy. And in our student population, there's not a lot of people like that, so we really don't use them a lot. The best thing to do is just, as Kara said, push your fluids, get rest, use the over-the-counter medicines for symptoms, and it'll run its course. And more importantly, get a flu shot.
Well, that leads me to my next thing, actually, because we talked about what flu and mono is. We talked about what the symptoms are and kind of that and the treatments of that. But even better than treatments and even better than any of that is to prevent. And so let's talk about the things you can do to prevent. What kind of prevention methods are out there for both of these things? But you said the flu shot. Let's start with that because it's something that McKinley gives away free to students and staff. And so that'll be happening again this fall. But why is that flu shot so important?
Well, first of all, you don't even have to come to McKinley to get it. We've got pop-up flu clinics all over campus once we start this. So you can go to Geese, go to Beckman, over at the Arc. I mean, we're going to have flu clinics all over. They'll be on the quad. I mean, you can find us anywhere, and you can go to the McKinley website or look it up online to find out where we're going to be and when. But the flu it's a different shot every year. It's not a booster shot, okay? It's a new vaccine every year, and they design it to follow basically the 4 main strains of the flu that were the dominant strains in the southern hemisphere the last 6 months, because flu cycles northern hemisphere and then 6 months later the southern and then the northern, and it goes back and forth. So they kind of track what's going on in Australia to help figure out what we need in our flu vaccine here every year. So they come out with that. The vaccine's usually available September, October, and we usually give it all the way through till April to make sure that people are covered.
What about, then this is always the big question. Somebody comes in and says, well, I got the flu shot and I still got the flu. What's the response to that?
So first of all, you're not going to get the flu from the flu shot, okay? It's not a live virus vaccine, which wouldn't give you the flu anyway. You may have an immune response when you get an immunization, that you feel a little tired, a little achy, low-grade fever. That's definitely not the flu, okay? That's an immune response. We expect your body to have an immune response. We hope it does. You're making antibodies. You're going to have those types of symptoms, okay? But sometimes the flu viruses change before they get up here to North America. And so maybe the 4 strains of the flu that are in the vaccine this year, only 3 of them are on spot. Maybe only 2 of them are on spot. So every year there's always a question of, did we get the right strains in the flu vaccine? So the efficacy each year varies a little bit. It's usually pretty good. It's usually anywhere between 75 and 90% effective. But that doesn't mean, it's not like armor, It's not like the flu can't touch you if you've had the shot. It means you've already made antibodies so that if you get exposed to the flu, your body's already to fight it. It's like having the firemen with their gear on and stuff ready to go the minute the fire starts rather than having to wake them up, right? So it may shorten, if you get infected with the flu, it may shorten the duration of your symptoms. You may get infected and not have any symptoms. But that's the way having a vaccine works. But it's not armor that protects you from even being touched by it.
But there is not a mono shot.
No, there's not.
So let's talk about things you can do that are not, injections, because there's things you can do with flu as well. But with both of these, because they're viral infections, any viral infection, what are some prevention things that you can do they're going to sound pretty basic, but what can you do?
The number one thing is to wash your hands or use hand sanitizer. Most people can get it now hooked to their book bag on like a little, keychain type thing they can hook on there. Easily use that. Basically, just wash your hands as much as you can and try not to share anything with anybody. Or I would say do not share drinks, do not share utensils, and wash your hands.
Inadvertent way, that was proven to be true by COVID, because we saw very few flu during that season because, one, we weren't around each other very much, but everybody was washing hands and everybody was using hand sanitizer and being very particular about that kind of hand hygiene. And we really saw, and we can see it in our numbers, that we did not have hardly any flu cases coming through. And so that's just a little bit of an unfortunate but positive that came out of that whole situation, is that we did learn that is so effective with things. And so as we're going into the flu and cold and mono season, just that's the biggest thing, is wash your hands and things like that. Well, I really appreciate you both coming in today and talking about these things. I know these are year after year. We've been on campuses long enough to see this is going to happen every year. We're going to have flu and mono. We're going to give flu shots and things like that. But just awareness is such a huge part of it. So I really appreciate you coming and talking and sharing about these viral diseases today. Thank you.
Thank you.
Good to be here.
We're back on campus. We're having that full swing of fall activities, and with that comes the flu and cold season, and you see mono and you see flu and you see all sorts of respiratory things come through. But there are steps you can take to protect yourself. There are steps you can take to be aware, to maintain your health and well-being in your time here on campus or wherever you may be. So if you have questions about it and you're not sure, give us a call here at McKinley. Check out our website, Ask the Chatbot. We want to help you. We want to educate you. We want to give you the resources that you need so that you can be healthy. Also, look for those flu clinics on the campus that Todd was talking about, because they will pop up and you can go without having to come to McKinley. You can go. It's free if you're a student. Just stop by, get your flu shot, and go on about your day. But if you have any questions, comments, you want to give any feedback, we'd love to hear about it. Get in touch with us here at Healthy Illini, and we'd love to pair up with you on your journey. Thank you for joining us today. You are on a personal journey, no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.